Don't let the white coat fool you. It's back. And listen, we get it. We know exactly what you've been through. Honey, we've probably been through more than you know.
Exactly.
And of course, we haven't really figured out, or we didn't when we were younger, of how to bounce back. We didn't know what to do to make ourselves healthy and well. We just kept going.
Right.
You just do what you know sometimes. Never saw my mom blink. So who knew about this thing they call self-care?
What is that? So
Child.
actually, when I think back about it, growing up, being in a very matriarchal family, lots of women in the family, gathering together in the kitchen, all the cooking and the chatter going on, they were handling it, handling everything. I had 3 aunts. They owned their own salons, so they were business owners. They raised their families. They had husbands. And I never saw them miss a beat. They were up late at night and the first one's up in the morning. My mom did it all the time. And guess what? That's what I knew to do. And that's what I did.
I had never really heard of self-care until my own children came along. Like, Lord have mercy, they always prioritizing their peace.
Right.
That's what they tell me. But I've learned.
I'm still
These
learning.
doggone kids was right.
Yeah, I'm still learning, being out in the community, being in my practice, I encounter people all the time. And I'm sure they look at the here and now and say, oh, life is great. Life is wonderful. But what did it take to get here?
Right.
And sometimes you see me and you think life is great. Life really isn't great. Life has a lot of aspects to it. And my life as a physician, as a practice owner, that's just one aspect of my life.
Right.
But I am also a mother. I'm a sister. I'm a daughter. I'm a friend. And I'm involved in other activities. And so my car breaks down. I have things that happen in my house, plumbing, and it's so difficult to try to even manage those everyday things because I don't have anyone else there to help me. And so even through the rearing of my child, being a single parent, all I knew is this is what I have to do and I got it done. But I never took time to reflect on what did I need for myself?
Right.
Never was a thought.
And listen, when you're in the profession that we're in, we tend to learn that we're last. I mean, we're always thinking about our patients. We don't even take time to go to the doctor ourselves because when we're not in, the patient wants to know, where are you? Where's my doctor? Why is my doctor not there? We don't take a vacation because we can't be out of the practice. But guess what? If we get sick and God forbid we die, somebody's going to be in the practice tomorrow before
And they're
we
going to say, oh, Dr. Mobley was so nice.
Oh, she was wonderful. Really liked her. You are Dr. Who? You're my new doctor?
Right. And life goes on. Life will go on.
That's right.
So as you think back, let's go back to medical school. Right?
Yes.
So I became a parent in medical school my first year. And I had a lot of hiccups, unexpected things in regard to, so I got my acceptance letter to medical school. And then 2 weeks later, I discovered I was pregnant. And so I had already quit my job and was working part-time.
Right.
So I thought, no problem. I'm signing up for everything in regard to school and I'm going to get the student health insurance plan, only to find out that pregnancy was not included as a covered condition. So there I was.
That's before Affordable Care Act, right?
Exactly. Before Affordable Care Act. And so fortunately, I had gone to school and had my degree as a physician assistant and have been working in OBGYN. So I understood prenatal care. And as a part-time job, I worked in the GEC. And so that's right. So I was around OBGYN residents all the time. So I had makeshift prenatal care on my own.
Wow. But everybody doesn't have that ability, but that's stressful. That was stressful. Oh my goodness.
So I knew how to prescribe my own prenatal vitamins. I knew when I needed my AFP performed at so many weeks, and to get my glucose tolerance test, I was able to get those things ordered and perform them on my own. However, the clinic that I had been previously employed with, a social worker there actually was instrumental without me realizing it. And she got me established with Medicaid, and I was able to have an obstetrician ultimately and had my delivery by a private physician.
Wow. Wow. Well, if you look back for me, though I was married and we had a planned pregnancy, 4th year, who knew I was going to have preterm labor?
Right.
Who knew I was going to have
Hyperemesis. Oh my goodness. I remember. Yes,
Oh
I
my
do.
God.
You and that cup.
This is a disease, ladies, you might not know of, but you just make a lot of saliva and you end up spitting all
And
the
it's
time.
thicker. It's thicker,
Yeah,
so
you
it's
get
difficult to
dehydrated.
swallow.
But I was good. I had my little coffee cup. I made it look like I was drinking coffee all the time, but I was actually very, very sick and very sick with
Didn't
this
you
first
even have
kid.
to have a PICC line at one
I
point?
had to have a line in and got IV fluids at night for my nourishment.
But you never
why?
missed anything.
I didn't miss a beat. But why? Why didn't I take time off? Knowing that was a problem, and that it could have been injurious to my kid, but I just didn't
realize it.
I just kept going.
And there was no provider that even spoke that to you and said, you need to rest and make sure you're staying off your feed, limit your stress.
No, my provider said, you're in medical school. I got the cure for that. We're going to put this thing in you, and at night you'll give yourself your IV fluids and you'll go on back to school. Because that's what they knew as well, So very, very interesting times we've come through to understand better how we should care for ourselves. Because, we probably didn't relate as much then to the fact that stress also affects our health. So our blood pressure is up. We're not mentally where we should be. We get problems with our weight, our diabetes. All these chronic illnesses are affected by stress. And who knew?
Some of it is genetics, but a lot of it can be what's going on in your environment. So true story, when you talk about how stress can be impactful. We go through our everyday lives masking, having that smile, going from one exam room to the next. This is me, my day. People from the front desk, I'm putting out fires everywhere, HR issues, and I go for my doctor's appointment. Finally, because I must admit, the only doctor I had was my gynecologist. I had not been going for primary care, managing, so used to just doing things on my own. So, and I'm healthy. I have no problems. I've never had any problems. Had some hypertension issues, but nothing major. And compliant with my medication. I leave the office after a unsavory encounter with one of my staff members, and I go and I get my blood pressure taken, 159/94, sitting there looking just as calm, cool, and collected. And I'm like, what? That cannot be. Well, Dr. Mobley, are you taking your medicine? Yes, I took it this morning, like at 5 o'clock. It's almost 9 o'clock. So what's the deal?
And we know it's not white coat syndrome for you.
It's not white coat syndrome.
You're not scared of your doctor.
Okay, no. So we do the protocol. We have part of the visit. I go empty my bladder, sit down, take my pressure again. It should go down. It was higher. 173/93. So, oh wow, we're going to have to increase your blood pressure medication, perhaps even add. So I had to reflect and think, okay, what's going on? Well, I had a very hectic day. I had clinic, leaving to go to Montgomery to meet with legislators right behind that. And then I'm supposed to go on vacation. When my vacation started, the whole first day, I just been in bed because I was so exhausted. And so I had to really do a self-inventory and say, okay, wait a minute. What are some other things that you are not doing for yourself that I used to do? And one of them is just my daily, I used to run. Now the knees don't let me run so much anymore, but at least I can walk and jog. I'm not even doing that. Excuses, hair. So get my hair braided. That won't be an excuse anymore. Or the time. It gets dark early. Well, the time has changed. So now I can start getting out, and I'm making the effort to prioritize myself so that I can have some inner peace, and making sure I sleep at night. And that rest is really important.
That's something we really didn't focus in on, how important
On resting,
that is.
no way.
Oh, gosh.
Not with our call schedules and raising our children.
When someone realized that the call schedule had to change, and even back then, I remember when the call schedule did change, we were like, these kids
got it easy.
They got it easy.
But who's seeing the patients? Who's doing this? Who's doing that? It's getting done, and they don't mind one bit. My shift is over.
Well, they're healthier. You know, I recall back before medical school, and we were PA, and we were working. I was working in GEC as well, the Gynecology Emergency Clinic, and I remember a resident being there. He had been on, I don't know, they had to be nearing the 60-hour mark of being on. And I just remember him starting to write a prescription, and actually falling over and just falling asleep next to me. And I was like, you know what? You're going to, let's let you go lay down, and I'll call you if anything's going on. But, you know, I was thinking at that time, man, he need to get on up. He ain't got no energy. He better get it together. But no. That was just too many hours, and you're going to make mistakes.
And you're going to make mistakes, and it's going to have a negative impact on patient care and patient outcomes. So there's a lot of positive aspects to the REC, coming up with those recommendations and making sure that the consecutive hours spent on call are distinct and have a clear-cut line on when you're to go home, and make sure you get that rest.
Yeah, so we want to encourage you, you know, who are out there in residency, you know, do that. Do that. Make sure that you are taking time for yourselves. We are on the back end here, finally taking time for ourselves. But you younger doctors, those that are in the middle, and those who are on our end of things, that's important. The stress.
What would you do different?
Oh my gosh.
So let's just go back without us telling our age. Let's go back about 20 years.
Yeah. What I
into
would
our
do
career.
Different. I think one, with that first baby, I would have taken some time off, knowing that I could pick up again. I think you start thinking time is getting away from you, and you want to continue. I didn't say that, you know, had a second baby. Now, the first one playing, the second one, Lord, where did he come from? But there he is. And the second baby had some health challenges. And again,
I remember that was such a scary time.
But again, what did I do? I continued to be there working while he was in the hospital. He was in the hospital almost 6 months.
I remember you never missed call, because he was actually admitted in the ICU where you were on call. And you continued your rotation.
I continued my rotation. Now, who does that? And why? Now, I had good family. You know, my mother-in-law was there, and that baby that I thought the first baby, she was the new mama of the new baby, so she was there. But I had plenty of family there. But there was no reason for me to not take a break and do what I needed to do. So I would do that differently.
So what is it about us? What do you think it is that's unique about being a woman of color in medicine? Because I think back, not with an ill child, but just having a normal, healthy child. Some of our counterparts, they took time off.
They sure did. They sure did.
And the call schedule continued to rotate.
I don't know if I thought, I just got to get done. You know, we put so much time into this, and I don't have any more time to waste. Well, what was I talking about?
What time?
What do I mean? What does that mean? had plenty of time. Plenty of time to get it right. And I would have been allowed to continue.
You would have been allowed. But we didn't even think of it as an option, I don't believe.
No, I don't think so.
Like I remember thinking, oh, I do not want to have anybody come in off of backup. Remember the backup schedule?
Yes.
If you were on backup, so this is it. You had a call schedule, and if there was a backup schedule in case someone called in sick, then you would have to come in. And I actually remember being sick. I believe I probably had rotavirus if I reflect back. And I remember one of my friends on call, she was like, just drink a Coke. I'm like, a Coke? I never even drink Coca-Cola.
Oh my gosh.
And I was going both ends. And guess what happened? I did not call in. I stayed, ended up going to the ICU, getting IV fluid. And I was going around that morning with rounds with the IV pole. I did.
Yep. I remember I had gone to see one of my medical school friends. This was while I was in residency. And we hadn't seen each other in a little while. And I had my oldest with me. And I was getting out of the car and it was raining. And I'm trying to run to her door with my little one in my arms while I slip and fall. So, you know, that mama instinct hit and I'm all over her trying to make sure she's not getting hurt. I go down on my arm like really hard. She's laughing. So baby's all right.
Okay.
Baby's all right. I'm all right. Go in, talk to my friend. No problem, whatever. So I'm supposed to be on call that evening. And I go in and I'm telling you my arm is killing me.
And it's your right arm.
It's not distorted, you know, it's not. Actually, I don't know. It was my right arm because I still have a little scar here from the burn from when I hit the ground. But that arm was like killing me. But I was working in the NICU, the neonatal intensive care unit. So, you know, that's no place to be. And you've got to, you can't leave.
No,
right?
you can't.
So I find out in there that I didn't really break my arm, but it was not until like 3 o'clock in the morning that I decided to go check and see. And I should have done that in the beginning, but the same thing you're saying, if something was wrong, I didn't want to have to call the backup. But honey, sometimes it's okay to call the backup. It's time for us to have some backup now. We've just got to prioritize caring for ourselves, because if we don't care for us, you know, when we go, somebody else is going to be in our place.
That's right.
Listen, ladies, everybody just take some time for you and know that it's important. It's an important piece of what we leave out of our care as physicians and our care as just people.